Jonah Comstock, editor-in-chief of pharmaphorum. I'm here at JP Morgan. It's Wednesday. I'm at the Zeppelin Hotel. I'm joined by Ryan Spencer, the CEO of Dynavax. Thanks for chatting with me, Ryan.
Yeah, thank you for coming over.
So, first of all, tell me a little bit about Dynavax. What do you guys do, and how are you kind of differentiated in your space?
Yeah, so we announced with our press release on Monday to kick off the conference a number of our key updates, which I think summarizes well what we do and what we're all about, what we have going on. So I'll just walk through that quickly. So we announced on Monday full year revenue for our lead asset, which is a adult hepatitis-B vaccine that uses our proprietary adjuvant to improve the dosing regimen. So we announced total revenue of $268 million for that product.
And that's in clinic.
Yeah, that's right. We launched it in 2018, so it's been continuously growing. So that's record revenue, as is every year, because we're on the continued growth path. So we're very excited about the achievement there. We also completed enrollment for our shingles clinical trial. So we announced that on Monday as well. So we now expect data to be available in Q3 of this year. And that, again, leverages the power of the adjuvant. So this kind of summarizes what we're all about, leveraging CpG 1018 to improve vaccines. And then we also announced another contract with the DoD to support our their plague program that we're helping them develop for another $30 million. So nice, important updates to start the year, but also kind of summarizes a little bit about where our focus is.
So tell me about this adjuvant. What makes it special?
Yeah, so CpG 1018 is a TLR9 agonist. So TLR9 is a pattern recognition receptor. It's found primarily on plasmacytoid dendritic cells, which are key cells in the immune response. So by including this with vaccine antigen, you basically stimulate PDCs, which then take up the antigen and kick off the immune response. So it's a very specific MOA for an adjuvant, and some of the key tenets, key value points of it is, one, with HEPLISAV, we demonstrated fewer doses, but still generated higher levels of seroprotection. But importantly, the tolerability profile is quite good for an adjuvant. Adjuvants oftentimes come with a sacrifice. You get great improved immunogenicity, but you have local or systemic adverse events.
Which, for a vaccine, is a particularly tough sell, right?
For a vaccine, it's an incredibly tough sell. Our product, which is a wonderful product, would not be very viable if it had a very intense negative tolerability profile. And so we think there's opportunities to leverage that comprehensive profile of an adjuvant. So that's actually what underpins our shingles program. The current vaccine on market is very, very highly efficacious. So you're not really going to do better than that. But it also has a pretty tough tolerability profile. And so we think by leveraging our adjuvant, we can improve on tolerability to the point that it provides a much better experience for patients.
For these vaccines for Hep B, for shingles, I mean, are these vaccines that everyone's getting, like a flu shot, or is it targeted populations who are at risk?
That's actually a very interesting development for our business over the last few years. So Hep B has been a very long-standing adult recommendation it was a risk-based recommendation. Risk-based recommendations are tough to administer because you have to have patients identify, or people identify, with risk factors. So physicians don't really know necessarily what your behavioral,
especially if they're stigmatized in some way.
That's right, which Hep B obviously had that challenge. So we saw some evolution of that recommendation, first including people living with diabetes, and then eventually in 2022 it expanded to basically all adults. So Hep B is one of the most widely recommended vaccines now in the U.S., ahead of pneumococcal, only behind flu really, and I guess COVID, because they have such broad age-based recommendations. So that's a bit of a hidden fact that not a lot of people are aware of, that now if you're an adult, you're recommended to be vaccinated against hepatitis B. And so it's a great advancement along the path to eliminate Hep B as a public health threat.
And what about shingles?
Shingles is an age-based recommendation as well. So over I guess it's over 55 years old is recommended to be vaccinated. So
shingles is the one that's related to chickenpox, right? If you don't get chickenpox, you can get shingles. It's much worse.
No, what it is actually when you did get chickenpox or were exposed to the virus, it's in your body. It's latent. So it's a latent zoster infection that's living in cells in your body that will reemerge. And when for most people, it reemerges. If it does, your immune system kind of knocks it down, nothing happens. But as you get older, that mechanism it's not as strong. And so what it'll do is it'll emerge and erupt in very, very painful sores and blisters and things on your body. So it's a very, very painful disease, and it can also cause other more significant outcomes as well.
So it's an interesting time to be in the vaccine space, given all of the ups and downs of the public perception of vaccines, right? I mean, COVID really was a big win for vaccines, but then immediately the backlash, the misinformation, the conspiracy theories. I mean, how much does that affect you in your day-to-day? How much time do you spend thinking about, like, whether people are going to be willing to get vaccines at all, and the ebb and flow of that kind of thing?
Well, we know that for prevention is always tough anyway. And we do know that there's certain parts of the population just that don't believe in vaccination as much as others. But the reality is, the coverage rates for hepatitis B are quite low, in the 20s, as far as that patient population that wasn't vaccinated as infants. So of that adult cohort, there's still a large portion of the adult cohort that is recommended to be vaccinated and is not. And so, frankly, while there's going to be we know there's a reasonable chunk of those patients that will just never get vaccinated because of whatever beliefs, or, as you noted, kind of some elements of the COVID pandemic and political elements that kind of emerged from there. There's still a lot of people that are amenable to taking a vaccine, and we think will eventually have good success driving those coverage rates much, much higher.
Yeah.
So
you solve for that first.
Yeah. I don't think it's a huge issue. I think it's I think we have great data, great science. The value proposition for being vaccinated is there. So we don't worry too much about it, although it's definitely part of our industry that we have to keep in mind.
I mean, any concern about Trump's cabinet picks and RFK, that sort of thing, or is this something you're looking at?
Well, no, I mean, we get the question a lot, but the reality is we have no real insight onto what the agendas will be. We know that we are quite proud of the work we've done with Hep B. We have great scientific data, which we are happy to share and make sure everyone's well aware of. I think Hep B is somewhat insulated for some of the areas that are discussed commonly when you think about vaccination in America. You already noted COVID has this political polarization sometimes. Pediatric mandates, which are always a hot button issue. Those kinds of things. We're sort of insulated from that for adult Hep B vaccine. So yeah, it's an industry thing that's going on, but ultimately too soon to tell, and it doesn't. I don't think has a huge impact on us.
Long term, how many kind of? I mean, you mentioned that this adjuvant seems to have a kind of a broad applicability towards like enhancing the effectiveness of other vaccines. So, I mean, is the sky the limit for you? What are you looking at next, and how many? I mean, kind of vaccinatable conditions are you hoping to sort of apply this to, and maybe increase the efficacy, decrease the toxicity, that sort of thing?
Yeah, look, I think the universe of simply taking something that's already there and adjuvanting it is limited. Like we know we did it with Hep B. Shingles was a new approach, but we're sort of following on the Shingrix product and using the adjuvant with the GE protein. There are a couple other targets that we have that is simply leveraging the power of the adjuvant against sort of known antigen technology. This is kind of how we consider what we've done to date with the adjuvant as far as in our hands. But we do have a wide range of collaborations where there's using the adjuvant in combination with more novel antigen discovery work.
Somebody else is working on something new, and you can enhance that.
Example, which is something we've talked about publicly, is our collaboration with Mount Sinai for universal influenza. They have a very robust universal influenza and pan-influenza program, or a couple programs funded by NIH and other mechanisms, and they needed an adjuvant, or they wanted an adjuvant to be used with this. And so we made 1018 available. We are not conducting that work. It's 1018 is a great tool as part to complement the novel antigen design that they're doing. However, we do think it'll be a very meaningful component of it. And so I think the sky's the limit from that perspective, in that while we have continued innovation in the space, adjuvants can be a meaningful part of it. And so we will look to do this in partnership with people.
Every year at JPM, it feels like I meet with vaccine companies that are telling me about the universal flu vaccine, universal COVID vaccine they're working on. And I don't doubt that people are working on it. But I mean, from where you sit, pretty immersed in the space and sort of involved in that, but like you say, it's not your thing. Like, when do you think we're going to see that? Like,
it's the holy grail, obviously. Flu is a very tough target. Even your point that this is not some new idea. There's just been constantly evolving approaches. I have no idea when we'll see it. I think, Mount Sinai has a great program, but in the end, you just got to get through the work, see the data, keep up with all of the great innovation that we have in our space, and keep trying new and different things. And so
the bar seems like it's simultaneously low and high, right? Low because the efficacy of current seasonal flu vaccines is not that great. Year to year, better or worse. But then high because you want to. If you really want to tout something as universal as effective, then it really has to work very well.
That's right, and it has to have a different approach than what we're doing for traditional seasonal vaccines.
Right. Can't just be
they're inherently limited. Because exactly. So it's just not that simple.
Yeah.
I mean, viruses, as we've seen with COVID and with flu, there's evolutionary processes that keep them ready to evolve in and around things. So the better you do, the more pressure you put on the virus to evolve and shift. So you're also dealing with that reality. Right. So I think the approach has to be unique, and it's a challenge. But look,
flu can come out with a new flu faster than you can come out with a new vaccine.
Possibly. I think that's why the MOA of whatever that universal solution will eventually be is going to be critical. But look, there's great work being done by people in the industry across different pathways and different ideas. So I'm hopeful that we'll eventually solve that challenge.
Anything you've heard at the show so far that was interesting to you, or just like trend stuff, something you've heard over and over again that you think is interesting?
Well, we spend most of our time here talking about ourselves.
Yeah.
So no, I don't have anything specific to comment on this year. For Dynavax, as I assume for many of our colleagues in the space, we're very excited for 2025. I think for us, this is hopefully will be a transformational year across our business, putting our shingles program on the map with very clear data and commitments to advance based on the back of supportive data, which is always nice, as well as continue to advance our lead asset in HEPLISAV and having another record year of revenue. Plus, we have some real desire, and this kind of gets back down to the macro factor, to continue to drive value through corporate development. So we're very active in looking at other ways to leverage our late stage and commercial capabilities by taking on new assets that could benefit, where we could be very beneficial in that transition, which is an important part of kind of what happens here.
As a company that's already in clinic, that's getting record revenues, as you mentioned at the beginning of the conversation, is the funding environment and the M&A environment, is that relevant to you? Are you keeping an eye on that? Or are you sort of a little more heads down doing your thing, making money?
No, the M&A environment and funding environment is relevant to us because of our corporate development desires. So while we're well funded for our development programs and our commercial asset, and frankly, we've already committed to profitability, recurring profitability on that asset. So we're very, very strong financially. We don't have to worry about us being funded. But when you think about M&A or corporate development or business development, access to capital for other ideas, it'll change the willingness for companies to transact, for example. Mm-hmm. So it is relevant to us as far as, will we have the access to the technologies? What does that look like? What kind of deal structures are there? Things like that. So it does definitely matter. The landscape matters, but we tend to focus first on what's the products, and then what's the strategy, and then we'll figure out some of the economics and how to get it done.
Cool. Well, thanks so much for chatting with you, Ryan. Really interesting stuff. And congratulations. It sounds like things are going well.
Thank you. I appreciate it. Thank you for coming over to our lovely accommodations, and really appreciate you taking the time.
Yeah, enjoy the rest of the show.
All right. Thank you.